Hey guys, welcome to Relatable. Happy Wednesday. This episode is brought to you by our friends at Good Ranchers. American meat delivered right to your front door. Go to goodranchers.com/Allie. That's goodranchers.com/Allie. I've got an amazing and fascinating conversation for you today. I am talking to Dr. Sally Satel. She is a psychiatrist who focuses on addiction, drug use, rehabilitation, but she's written a lot, especially over the past couple of years, about how woke ideology, how progressivism is really pervading not just psychiatry, but really medicine in general. We're going to talk about the consequences of that, the consequences of an overemphasis on victimization, how this idea of placing people on some kind of intersectionality scale, how critical race theory is really harming psychiatrists' ability to treat people as individuals. And we'll talk about counseling and how counseling is being characterized by this as well, and potentially harming people and keeping people away from getting mental health care that they need because of this wokeism and people's fear of being treated by a therapist who would be hostile to their conservative or their, in our case, Christian views. So we're going to talk about all of this, kind of where this came from, and we're going to focus a lot on this loss of agency that seems to be infecting not just this industry, but the world, assuming that everyone's issues they're a problem of some grand systemic problem rather than a problem of an individual's choices, and how that can negatively impact our world and people's mental health. And just kind of putting this all into context, the mental health numbers that we see, especially among young people, are really not good. They're really not good. If we're looking back at 2020, we see a 31% increase in health-related emergency department visits for kids ages 12 through 17. For young adults, we are seeing 3.8 million had serious thoughts of suicide in 2020. And then recently, there was an article written by the New York Times talking about this epidemic among young people of thoughts of suicide and depression. And of course, the New York Times doesn't come to the same conclusions that you and I would. It does talk about social media a little bit and the problem there, and of course the pandemic, but also I think that we would conclude that there is just a loss of purpose, there is a loss of community, there's a loss of fellowship, and from our Christian perspective, there is a loss of faith, there is godlessness that seems to be pervading the younger generations. Actually, we know for a fact that it is. Pew Research does research on this regularly, and the loss of church and religious affiliation among young people is dramatic. And we're not focusing on the younger generations in our conversation with Dr. Satel today, but I think it is very indicative of where we are as a country as far as how we are serving people in the mental health industry. We talk about on this podcast a lot. I wrote a book about it, how it seems to be the solution to all of our problems. We are told on Instagram, we are told by people like Brene Brown, we are told by the popular authors that are kind of targeting women, and in particular Christian women, that really fundamentally our biggest problem is that we don't love ourselves enough, that we don't empower ourselves enough, that we don't think about ourselves enough, and anything that inhibits us from being able to put ourselves first is a form of trauma, and that we are really victims of most things, if not all things that happen in our lives. How's that working out for us? How's that working out for us? Is that kind of mentality really pushing us towards viable solutions to make sure that we are not riddled with anxiety and depression, that we are stable and sane people? It doesn't seem to be helping very much at all. And so we're going to talk a little bit about that today. At the beginning of our conversation, I'll ask her that question. How is pop psychology and this focus on ourselves, how is that affecting the therapy world? How is that affecting us as people and as a society? You're going to love this conversation. She's a fascinating and brilliant person who is doing very unique and counter popular narrative work in this space, and I always appreciate those voices, and I know you do too. So without further ado, here's our new friend, Dr. Sally Satel. Dr. Satel, thank you so much for joining us. I have read many of your articles, listened to lots of interviews that you have done. We're going to talk about a few things today that you've covered, but I want to start with a question that I know my audience has, majority women. We are met with a lot of Instagram psychology, a lot of advice on how we need to deal with all of our problems, and it seems to go back to this one prescription, and that is that we just need to think about ourselves more. We just need to think that we are more awesome and wonderful, and that all of our problems are a result of some kind of victimhood of other people, of society, of our circumstances. There seems to be a real aversion to talking about any kind of responsibility that we might have in the problems that we face. Everything comes back to just a lack of self-love. So I would love to hear you talk about that. Is that something that you see kind of in the therapy world in general? What are your thoughts?
Well, my first thought is I wouldn't do therapy with a stranger who talks to me over Instagram.
Yeah.
And the main reason is because, one prescription and one diagnosis, so to speak, never applies to everyone. So right there, you're almost violating one of the tenets of real psychotherapy, which is a highly individualized kind of enterprise where the therapist gets to know the person. And, some people probably do. I don't doubt that there's a great deficit of self-love. I wouldn't call it that, but that's not the term I use. But basically, a feeling of self, or a lack of the feeling of self-worth, and can be devastating. I mean, that is what can lead, not always by any means, but can lead to I don't necessarily clinical depression, but a pervasive feeling of demoralization. Can lead to drug use. That is a problem. But A, you can't assume it, and B, you certainly can't assume that it's due to victimization by parents, by husbands, wives, by others, by society. Now it's of course, much systemic oppression, and even if that might be true, which is something I would only know after I get to know someone, then I would not encourage them to dwell on it, which is another problem that seems to be part of this worldview, which is that, hey, you've been victimized, and so you're entitled, and so really you don't have to do anything, you don't have to take any responsibility because you're the victim. Listen, to be honest, some people are victimized, there's no question about it. But the real purpose of therapy is to show people how to put that in context, to rise above it, to make sense of it in their life in some way, to not let it'll change them. Any kind of victimization changes a person, but not to damage them.
Right. It seems to me, just as a person observing all of this, it seems to me to be an overcorrection because, of course, there's a problem of self-loathing and self-hatred. And that, to me, it would make sense that could lead to different forms of addiction and demoralization and anxiety, of course. But the constant focus, at least that we hear on Instagram and pop culture, on what I would call kind of a glorified narcissism, that nothing really cares, or nothing really matters. Your relationships don't matter if they are not perfectly serving your wants in every moment of every day. That doesn't seem to be working because we've been told this for a while now, for years, and yet our mental health, our state of mental health as a country, particularly I would say people under 40, seems to be worse than it's ever been. I mean, my generation, millennials, have been told our whole lives that everything should revolve around us, that we deserve a trophy no matter what we've done. And yet it's not translating into us feeling better about ourselves or our lives. So do you see that kind of relationship, that the more we're forced to just focus on ourselves constantly, that it's actually making us feel worse rather than better?
Yes, I can easily see how that could happen. First is prescription for selfishness, and we know that one of the great things people can do to make themselves feel better is to help others.
Mm,
So you want to direct as much of your attention outside yourself as you can. At the very least, it's distracting, so you're not ruminating
right.
about your problems, but it also helps others, and that's very gratifying. And as you know, in AA and other kinds of self-help, that's one of the tenets of it, is that it's a fellowship where you're helping others and connected to others. And the other problem with focusing so much on yourself is that everything is everything is blown out of proportion. Every
Mm,
little slight is taken as evidence of I'm not lovable, or that person is terrible, or
right.
it's just distorts your whole view of, frankly, of others, because people are always attuned to the negative much more than the positive, unfortunately. But I think we're wired that way, as through evolution. We always have to be on alert. Um, and it blinds you to, for example, what you might be doing. I mean, listen, this is one of the purposes of therapy. I mean, there's therapy for people. I'm a psychiatrist, so we deal. Well, my personal interest is people who are really mentally ill.
Mm-hmm.
For example, they have psychotic problems, so their symptom, we want to get rid of the hallucinations and the delusions and that kind of thing. But in the kind of therapy you're talking about, which is for people who have problems in living, or even people who are very, very distressed. But one of the things is to, as I say, not only get out of yourself, but to develop some
That's okay.
insight, and introspection, so you can see how you sabotage yourself. I mean, that is such a big part of psychotherapy, is to help people understand how unwittingly they're working against their own best interest.
Mm,
And again, if you have this mindset of blaming everybody else, it's not conducive to gaining much, to not being introspective. So it's
mm.
it's it's just destructive on so many levels. I mean, when you first get to know a patient, and again, we're not talking about a patient relationship on Instagram. I mean, you listen to folks talk. You basically spend the first several sessions listening to them blame everybody else, but
Right.
then. Because you can't challenge someone out of the gate, you want to develop
Mm,
a relationship that you're, concerned, and you're open to their perspectives and their complaints. But then you start, if they're open-minded, and if they're not psychologically minded, why are they in therapy at all? If people are so awful to them, or if they've really been so misused by the system, they need a lawyer and not a psychiatrist.
mm.
I mean, our job is to, again, is to help people cultivate a kind of a posture of self-observation.
Why do you think a segment of psychiatry, whether it's just, pseudo psychiatrist online, or whether it's, an actual therapist in the office, why do you think it's moved this direction towards taking all agency away from someone and trying to soothe someone's anxiety or depression or distress simply by blaming systems outside of them, blaming other people, and basically just telling them that everything that they're doing is right, and any of the problems that they're facing really can be placed on other people's feet? Like, what ideology or what trend is moving mental health medicine in that direction, if you think it really is going that direction?
I don't see it going that direction in psychiatry. But
You
look, a
don't.
lot of these people, let's say, to be honest, well, good psychiatry. And
Yeah.
that is a big qualifier, I realize. But,
Mm.
if you're not trained, then you're going to imbibe all these cultural tropes, which have been, victimhood. And as you said, everybody gets a trophy, and everyone needs self-esteem. Well, you have to earn self-esteem. Yes, of course, there's a basic level of, self-worth. Everyone should have. But above that, you have to earn these things. And I think that some of these therapists are probably extremely, I'll just say it, they're just immature. And it's gratifying to them to have the kind of gratitude that the public would perhaps offer them, because that's a very quick way to have people be grateful to you and to attract them, is to exonerate them. I mean, everyone wants to be exonerated. I do. I don't want to sometimes take responsibility for, or acknowledge that I may be contributing to the trouble I'm in, or the distress I feel. But that's the mature stance. And part of therapy is to learn how to deliver some of these hard truths, but in a respectful and caring way. I mean, so much about the training is learning how to deliver these, ask these questions about, well, maybe, did you ever thought of maybe there's something you're doing, you don't quite realize it, but what might you be doing that maybe elicits this response all the time? Because it seems to be a pattern. I mean, clearly, if something's a pattern, that's your wedge into helping the person become curious about, maybe, why is this happening to me all the time? Could I possibly be contributing to it in some way?
Yeah.
And all that takes time, and it can't possibly be just, in a Instagram. Isn't Instagram like several? It's really short, right?
Yes.
So you can't get into any
detail. Or it's mostly graphics.
Subtlety.
Yes. It's mostly kind of graphics that people, there's just a lot of, even if the people posting these things don't consider themselves therapists in some way, it's just a lot of very trite phrases that I think people internalize, and they think counts for like helping their mental health. Things like, if someone thinks you're too much, they should just go find less, and you need to cut all the toxic people out of your life, and you deserve more. And maybe those things are true in some people's situation, whatever. But as you mentioned, the people that are posting those graphics for likes, which you just said, that's why they do it, because people like to feel exonerated. And so if you're posting these things on Instagram, people are going to follow you because you make them feel better about their circumstances, perhaps because you are kind of alleviating any responsibility they may feel. But it's all of just these little trite mantras and sayings that they're aimed at making women feel better about themselves. But at the end of the day, I think it really just makes a lot of people more selfish and justify their selfishness as saying it's a form of like growth and maturity. But really, it's actually the opposite. It's immaturity, because they're blaming everyone else for their problems. Okay, quick break to tell you about our first sponsor for the day. I absolutely love this sponsor because their product is amazing. That is Cozy Earth. Guys, these are like the best sheets ever made. I can always tell when my Cozy Earth sheets are the ones that are on my bed because they just feel so good and just far and away better quality than the other sheets that I have. Love Cozy Earth, love the material. It's super breathable. It's really soft. It gets softer with every wash. It lasts for a really long time, and they don't just have sheets, they also have loungewear. I love their lounge set. Wear it all the time, especially in the winter, but it's really kind of like a year-round thing because of this soft material. So the sheets are made from the finest luxury materials, including soft viscose from highly sustainable bamboo. Their bedding is not only super soft, lightweight, and breathable, but temperature regulating too. That is also true in my experience of their loungewear. So they've just got top of the line products that are going to make your life a lot more comfortable. And hey, if you don't like it, which is just not going to happen, but if you don't, they do offer a 100-night sleep trial, which means you have up to 100 nights to sleep on the sheets, wash them, try them out. If you're not totally satisfied, all you have to do is send the sheets back for a full refund. And for a limited time, you can save 35% on Cozy Earth by going to cozyearth.com/Allie, enter code Allie at checkout, and save 35%. Amazing deal. That's cozyearth.com/Allie, enter code Allie at checkout for 35% off. But it seems to be linked. It seems to be linked to an ideology that you've talked about a lot that seeks to remove agency from people and put it on systems. And you kind of got in quote unquote like trouble, maybe a controversy for this at Yale University last year when you were talking about the opioid epidemic. You gave a lecture at the Department of Psychiatry there at Yale, and you talked about both the internal and external factors that can lead to substance abuse. But there was an unidentified group of concerned Yale psychiatry residents who took issue with what you said, basically said that it was racist, that it was classist, and I don't know, I guess that you didn't blame the system quite enough. Can you talk about what happened there and how that may be indicative of something pernicious that's happening in psychiatry as a whole?
Well, this is happening in medicine as a whole. It's very worrisome to me. It's what I call a kind of a woke intrusion. I always have to put quotes around woke because people criticize you for that not being a real issue. Well, it certainly is a real issue. And the way it often manifests, again, is that, frankly, almost every problem, and in the case of medicine, it's a health problem, is due to systemic forces. And, look, again, sometimes I'm not saying that's not never the case. Mm-hmm. The question is, what are psychiatrists supposed to do about it? We can diagnose, we can treat, and believe me, doctors don't get to spend enough time with patients. That's one of the real problems. But we can inform policymakers about the kind of external forces that affect health, and hopefully they can enact some reforms. But we already have a job, and if the public sees this as too politicized, it's really going to damage our credibility. So, but one of the big themes that was pretty 100,000 feet. But, but one of the big themes is that in this talk I gave was about a year I spent in a fairly small town in southeastern Ohio. It's called Ironton for anyone who's may have heard of it. And I was just back visiting, and it's a town of 10,000, and it's in some ways like so many of the towns we've read about, where the economy is struggling, and drug abuse is a huge problem, and now the opioid crisis has largely moved on to fentanyl, which is very deadly. So lots of overdoses. It's really very tragic. I was talking about addiction, which I frankly think is kind of more productive to see as a symptom even than a disease, because it often points to something a person is trying to either medicate within themselves, or if they live in a community that appears to hold no future for them, as I said, is economically distressed, where the educational system is so bad, where their parents maybe have drug problems as well, and you live in places where you feel trapped. That in itself, I think we've heard of deaths of the despair. Well, these are lives of despair, and that also makes drugs look attractive. But we also know that most people recover. Actually, that's not known, but most people actually recover, and they recover without professional help. But I'm not arguing you shouldn't get professional help. Anyway, so I was talking about this, and then afterwards, one of the residents said he was offended because I talked about agency and addiction, and and that didn't I know that people were basically using drugs because of systemic forces, and again, even if they are, then what's the solution to that? For us as psychiatrists? And I said, well, our job, I try to remind him really as nicely as I could, but our job is to take those remnants of agency that everyone has. I mean, even when you're in the midst of addiction, you make all kinds of choices. Is this the day? A lot of people who are addicted are actually fairly functional. I think we have this sense that people are just strung out, nodding out all day, and some people are, but that's not typically. People do things. Actually, people hold jobs now, probably not as well as we think they. They don't work. They're not the best workers necessarily, but they do. Or they go pick up their kids from school, or does your dad pick up you from school, or or whatever. All these kinds of choices people can make, and those choices, of course, could be today's the day I go to treatment. The problem is so many people who've used drugs for so long um, already were attracted to drugs because of some sort of pain that they were trying to medicate. And I don't mean physical, I mean psychological. And then there's a second layer of distress that's built up by all the trouble and problems that have been generated because of the addiction, all the friends you've lost, all the relationships you've burned, all the jobs you may lost, the money you spent, the health that you may have lost because of it. And that in itself is so distressing that it becomes even harder to stop. So I'm very sensitive to the notion that it can be very hard to break the habit, but people do it all the time. And they do it by largely by us being able to show them that there's some kind of hope and there's some kind of help, so they can feel that they can do it. And there are strategies called relapse prevention, and we have medications. If it's an opioid problem, you can be on methadone or buprenorphine, all these things to break the cycle, and then start helping people rebuild their lives. But I told him, I feel I'm going on here, but I basically told this kid, I mean, it was 24-year-old, I'm sure.
That's a kid, yeah.
A resident that, well, thank goodness there is some traces of agency still left, because that's what we can work on. And that is our job, to help people basically, weave those tatters into a tapestry of mastery, because that's really, again, unless we're talking the severely mentally ill folks who need, real symptom relief, that's ultimately what we are talking about, is the kind of self-control that lets you have more choices. And so you don't feel, constrained that there's only one way for me to act, that you can step back and see that there's an array of things you can do. And I mean, that's the ultimate freedom, but that only comes with responsibility and self-control. I mean, that seems, I think, somehow counterintuitive to some people, but you have more freedom when you have self-discipline.
And, this is a Christian podcast. And so people listening to this know that self-control is a fruit of the Spirit. Self-control is something that Christians are supposed to don and supposed to emulate. And unfortunately, I do kind of see a lot of Christians fall into this woke ideology of only blaming other things for people's problems. And as you said, it's not either or, it really is both and. And you've talked about this problem within psychiatry, or I guess, as you said earlier, in medicine as a whole, of removing agency and taking away a doctor's responsibility to more look at the more proximate causes of what's going on, and to kind of just become activists and experts in things that you guys didn't go to school for, like housing and things like that. That doesn't mean that you shouldn't care about that, but what I've heard you talk about is that trying to get doctors to only look at these big systemic problems, potential systemic problems or verified systemic problems, and taking them away from actually treating the symptoms that are right in front of you and looking at the possibility of agency and the role that it plays in a person's problems, that's actually hurting the industry as a whole, correct?
Well, it's a very worrisome experiment that's going on. I mean, you mentioned, for example, housing. Now, we know that especially for kids, some of this public housing and other kinds of really, poor quality housing, lots of roaches, lots of mold, lots of allergens. And for kids with asthma, that's terrible. And it was important research that doctors and other scientists did to discover what kinds of what kinds of irritants are out there and are part of housing. And I'm sure ventilation is not good in these places. And that was an important research. I'm not saying that by no means should that not have been done. That's very important. And that has to be, and people who run housing systems have to know that, and doctors should even frankly ask about that. Where if the kid comes in with these problems, where are you living and is there mold? I think that's perfectly reasonable for a doctor to ask, and that then goes to the social worker. Listen, we have to try to help get this family a better house. You could even report it. There's nothing wrong with that, reporting it to the housing authority. But to take on housing policy is absurd. It's a distraction from what we do. Plus, we don't know how to do it. That's not what we're trained in. And also, since, to be honest, so many doctors these days are quite progressive, they might have a different notion of how one fixes housing policy that might be, in a direction that is, frankly, not compatible with the general view of patients, which is, why is my doctor getting so involved with this? They should be spending their time, with me. Now, that may sound like a slightly tortured example, but honestly, if you read, it's a new publication from the American Medical Association and others, they truly want doctors, or they urge doctors to, dismantle racism. And
right.
I don't know quite what that means. I'm not denying that there is some, but I'm not denying that there's remnants of systemic racism, probably still some that's active. Not denying that. And as a citizen, I'm a doctor, but as a citizen, if that were my passion, then I should work on it all my spare time. That's completely fine. But framing them as part of the mission of medicine is really destructive. My mission is not to be a social justice warrior. My mission is to treat health. Treat illness. And my identity, again, would be that of, a healer, not an activist. That's something I can do in my own time, for sure. But that's not part of my identity as a physician. And there's a real effort to try to change that. And here's just one example. Folks who have diabetes, and this is overrepresented in minority populations. Some people need insulin, some people need other medications, but everyone, even folks who don't need the medication, can control it with diet and exercise and these kinds of elements of self-care that doctors have to bring to their attention. These are other things you can do to control your diabetes. I personally find it's still unbelievable to me that a doctor, once the door is closed and once they're with the individual patient, would not bring these up because they require initiative on the part of the patient. And of course, if we're conceptualizing every patient as a victim of systemic injustice, then that doesn't fit. But that is practically what is being that the nature of some of the discussions are such that you could get in trouble for that. I was in a discussion, a colleague was in a discussion about the awful increase in suicidal and depression and suicide in young Black teens. I mean, the rate of increase there is higher than in any other group. The absolute prevalence of suicide is less, but the increase is higher than in any other group. And the only explanations that were entertained was that of, again, systemic racism and police brutality. Not about, and we weren't allowed to talk about, what do I mean allowed? Well, you would basically get a lot of criticism from your colleagues. But to talk about the bullying in school, which is just awful for some kids, and the violence in the neighborhoods, which is utterly terrifying. But that was not considered a legitimate hypothesis about what could be going on in this community to contribute to the distress and hopelessness of these kids. And that's dangerous.
All right, second sponsor for the day, and that is Raycon. So Raycon has amazing wireless earbuds for just a fraction of the price of its competitors. They are a must-have product if you are a busy mom, you're doing a million things at once, you want to listen to this podcast, but you want to make sure that your hands are free, that you can go where you need to go, whether you're on a walk or in the kitchen, whatever you're doing, you want a premium listening experience that makes your life easier and more convenient. That's what you get with Raycon. They come in a bunch of fun color options, so you can find a color that suits your personality and your style. Also, guys, this is a great gift for your wife, or maybe this is a great gift for your mom for Mother's Day. For the mom on the go, Raycons offer 8 hours of playtime and a 32-hour battery life with their compact portable charging case. They have over 49,000 5-star reviews, perfectly fitting for a 5-star mom. So tell mom how much you love her. Make sure she hears it in crystal clear audio quality with Raycon. Go to buyraycon.com/Allie. Get 15% off your Mother's Day order. I have the rose gold earbuds. They're super cute. They're very fashionable, so maybe that's a good option for you. Go to buyraycon.com/Allie, 15% off your Mother's Day order. That's buyraycon.com/Allie. Gosh, my mind is bursting with so many things. When you start with the premise of critical race theory, which is basically in crude forms that all white people are oppressors and all black or brown people are oppressed by these oppressors, and if that really does characterize how you diagnose someone and how you look at the causes of their problems, I mean, that's going to lead to, disparate treatments. It also could lead to wrong treatments because you're not willing to look at the real problems at hand. Like you mentioned, if a young black man, if he is suicidal because he's actually being bullied by people of his own race, but you're not allowed to look at that because it has to be some form of white oppression, well, then you're going to miss the problem, and you could miss the diagnosis, and you could miss the treatment that person could suffer. And really, gosh, we see this in so many areas when it comes to this so-called anti-racist work, that you have to assume that the problem is white supremacy. And again, that's not to say that racism is never the problem. But if you assume that, then you could actually miss the other issues that are at hand, and you fail to address the real problems that are causing this group to suffer. We've talked, and I've heard you talk about this a little bit, but we've talked about this before, about how the maternal mortality rate among Black women is higher than that of any other group. And, there are probably various reasons for that, but the only assumption that I've heard is that it is systemic racism, that it's racism against these Black women. I'm not sure. The CDC also says the number one cause for maternal mortality is high blood pressure and heart disease. And we know that to be more prevalent among the African American population. So maybe that's part of it. But something that I found interesting in my research is that actually the number one cause of maternal mortality that is not included in the CDC numbers is homicide. And it is about 8 times more likely among Black women who are pregnant than women of other races. And I think it's 3 times more likely when those Black women are pregnant versus when they're not pregnant. And it is typically by a domestic partner. That's one example of, okay, we're focusing only on the problem of potential systemic racism. Well, look at this huge problem over here that is actually much more prevalent and killing many more women, more Black women in particular, than this problem. I'm not saying we can't focus on both, but when you are missing this huge problem over here because you only want to focus on systemic racism, people are going to die because of that. You're creating more victims. So I'm just interested to hear, more of your thoughts, not necessarily on that, but how this idea is dangerous and manifesting itself in the industry that you're in.
Oh, it's very apparently we're not, I don't work in a hospital, but I've been told that doctors shouldn't even bring up obesity. I mean, right. My goodness, it's just, it's unconscionable. I've noticed it more in collegiality, actually, that there's people are sensitized to, or younger people, there's a generational dimension to this, but, sensitized to microaggressions where, that obviously we should also treat each other with, respect and concern, and try to always give people the benefit of the doubt. But basically a microaggression is it's truly in the eye of the beholder. And but these things are just completely taken out of context, and colleagues are walking on eggshells. And some of my colleagues are, to the extent they have discretionary time that they can spend teaching versus, let's say, being in their lab or writing or something, they will not choose to spend that added time interacting with residents and medical students out of fear that they're going just to step on some sort of that they'll commit a microaggression because they'll step on some landmine like I did. Those students asked the chairman to revoke my appointment. Wow. And good for him that he didn't, of course. Yeah. But that's their solution to things is, my talk took place on January 8th, 2001. Mm-hmm. So they said that I re-traumatized them after January 6th. Apparently the other thing that was so offensive was to call my talk My Year Abroad, and then, about being in this town. And that wasn't, because that, to them, that was so othering and so dismissive. And I thought, well, that's an interesting, way to think about it. And maybe I'll be more sensitive to it in the future. But let me tell you my intent behind it. Right. The idea that we all live in one country, and yet there are so many differences, and that trope of My Year Abroad is almost always heard in the context of, I had a fascinating experience. I met new people. My horizons were broadened, right. But there was no tolerance of this, these alternative explanations. So it's that, plus there are certain things you can't question. There was a professor at the University of Pittsburgh medical school, brilliant man, cardiac electrophysiologist, who was beloved teacher. And he wrote a very scholarly article that was peer-reviewed in the Journal of the American Heart Association, questioning affirmative action in medical schools, and presented the data, showing that, for reasons of being folks just not prepared, nothing about their basic, worth as people, just that they often come into medical school or residency, just less prepared than, let's say, white students, is largely a black-white thing, and take longer to graduate and come in with poorer scores and all this. That he was questioning whether this is a policy. God knows he's not the first, that we should that medical schools should pursue, because right. Advanced education is not the place where you compensate for people who sadly have been not trained, not given the best primary school educations, and that compounds itself, and people get passed on in school without having mastered certain things. Anyway, point is, he was fired for this. Yeah. He was lost the chairman, he lost the directorship of his fellowship. I misstated that. He wasn't fired from being a doctor from the school, but he lost his directorship of the fellowship. He's not allowed to have contact with residents or medical students. And here he is, this brilliant teacher who's won awards, and that's insane. The same thing with some researchers who are looking into genetic differences that may, in one case, may translate it into why. There were probably many reasons, and some of them definitely were class reasons of the kinds of jobs people had, the fact they had to take public transportation, but why African Americans were disproportionately felled by COVID. There are lots of reasons, but one of them might actually have been, we'll get into it in depth, but basically some sort of genetically mediated metabolic dynamic in lung function. Okay, and that was written up. I believe it was in JAMA, Journal of the American Medical Association, and there was all kinds of pushback because we're not allowed to explore genetic differences that may associate with race. And of course, I have to underline associate, because like every educated person knows there are no discrete genetic differences between race, but there are differences in what's called gene frequencies. In other words, how common a certain gene might be, a gene that might predispose to illness, based on where one's ancestral heritage is. I mean, the classic one being sickle cell, that people whose ancestors have grown up in the Mediterranean or African region can have,
but to
more
your
susceptibility.
To your point, I was actually just reading an article because I met a young woman recently whose son was born premature. He had sickle cell anemia, and gosh, it was just so hard listening to her and what they're going through. And I decided to just do some research on it just to find out more about it. I knew it was more prevalent among African Americans, but the article that I found was actually debunking the myth that it's more prevalent in African Americans, because it seemed like, because of what you're saying, that for some reason you're not allowed to talk about that is somehow racist. But to me, that would lead to worse care for Black people, because I mean, the doctor's not even allowed to see something that's true because it might come across as prejudiced in some way. That's crazy.
Yes. I mean, one thing I've seen people complain about is it's not just an African-American affliction. And that is true. It could be a Mediterranean affliction. Okay, well, that's good to know.
Yeah.
But we have to know this about people who are from Greek heritage, as well. It's more information. And, of course, it has echoes, to me, very diminished echoes, but to some people, obviously louder echoes of eugenics, this kind of stuff. But we are well past that. We have very, very vibrant bioethics, bioethical. We're all very, very sensitive to these histories, and in fact, of course, with the vaccine, you would hear. It's funny. I heard both things, but you would hear, well, I'm hesitant to take the vaccine because of Tuskegee, and then I heard Black people say, "Oh, stop it."
Yeah,
that's they'd say, "Oh, come on, that's just an people just say that as an excuse." But other people seem sincere, and every time if there were an article in the New York Times that always gets a million comments. I mean, it would be interesting, and I did look through them, and there were a number of people who identified as African American and said, "I'm not going near that," and they invoked Tuskegee and. So to them, I think they were sincere and it was real. So what do we do about that? Well, one very common and often effective strategy is to enlist pastors and other people who are respected in the community to try to demystify, these interventions, in this case, a vaccine, but to, help folks realize that those days are past, and white people are taking the vaccine. So obviously, if it were so dangerous, they wouldn't be doing it. And I took it, and nothing happened to me, and this kind of thing. But so those specters are still around, and they flare up from time to time. But they should never be used to suppress information or to suppress research that's done in good faith. Never.
All right, third sponsor, and that is Birch Gold. You guys know things are very unstable and unpredictable right now economically. Everything going on with Ukraine and Russia is causing even further destabilization. Food prices are soaring. Gas prices are soaring. To quote our dear president, with regards to food shortages, it's going to be real. And as inflation continues to skyrocket and the dollar becomes less every day, you absolutely need to transition some of your nest egg to something of worth with gold and silver from Birch Gold. Birch Gold will help you convert an IRA or 401k into a tax-sheltered secured account in gold and silver. So go ahead, get started now. Text Allie to 989-898. They've got thousands of satisfied customers. Check them out for yourself by texting Allie to 989-898. When you do, you get a free info kit on gold with no obligation attached. Text Allie to 989-898. That's Allie to 989-898. Right. And I just want to clarify for people that our point really isn't about the vaccine. There's plenty of controversy about the vaccine and side effects and things like that. The point is that when any industry is basically saying that all, or like this fear of microaggressions towards people of one group that is considered marginalized is actually inhibiting medical professionals from treating these people in a way that is right, in a way that has to do with the actual causes and the actual symptoms that they are seeing before them. When you kind of move outward and say, I'm only allowed to look at these kind of systemic issues, and you become an activist rather than a healer, then we have a problem. And it kind of is, oh, I love hearing the little meow. That's cute. It's kind of indicative of everything that we're seeing, that if you don't say that a disparity is caused by discrimination, that there are possible other causes for this disparity, then you are considered an unempathetic person. Like what? How did this start? How did it start that people that kind of activism started pervading the medical industry, and that everything just became some kind of symptom of trauma? Everything is considered trauma nowadays. How did that start, and how did it really start infiltrating the industry that you're in medicine in general?
Well, in about 1990, there was a concept called social determinants of health. I mean, that was coined as a concept. Obviously, it's been around forever, and it's very legitimate. And when I was in medical school, I don't think we spent enough time on considering, we mentioned these earlier, but considering these other dimensions that affect health and affect people's ability to, what kinds of choices they have about their health. Like, just for example, it might never occur to, I mean, I'm a psychiatrist, I don't give medications that need to be refrigerated, but some medications need to be in a refrigerator. Right. And it would never, often never occur to a doctor to inquire, do you have, is your electricity working? Do you have people living in your household who might steal your medication? And those things are, important. Do you have transportation? You're going to have to come back. I'm going to have to check this dressing, if you've burned yourself and now I've, put dressing on it and antibiotic cream, that's going to have to be changed and checked to make sure it doesn't get infected. It never occurred to them that the person couldn't come back because they had no, this is an older person, let's say, they couldn't come back. So because they had to take 3 buses, or they lived in a place where there wasn't, good public transportation. These things are important. You don't have enough money to, sometimes certain diets are indicated and they're more expensive. I mean, these things are very, very important. And I don't think doctors often paid enough attention, to be fair. And they should have, and I think they do now. And that was called social determinants of health. But over time, that got... I would use the word, almost got perverted into this view that people are completely at the mercy of their environments and have no control at all. And after George Floyd, the murder of George Floyd, this just took off. Where now most medical schools have courses on implicit bias training, which we know there's been ample research that shows the implicit association test, which supposedly measures racist attitudes, is completely illegitimate in terms of predicting how people interact with minority individuals. But that's required in some medical schools. Some departments of health are requiring that in order to get your license renewed or get your license, you have to take this. It's a waste of time, and it draws attention again to this this conflict, this as if it's pervasive, this struggle between races, and it's frankly, it's pernicious, but it's a waste of time. And so this became, after again George Floyd, this just became a big thing with medical schools dedicating themselves to the phrase, of course, is dismantling racism. Some of that's posturing, I'm sure of it, but some of it's not, and it makes me wonder what they're displacing in the basic curriculum, which is very packed, to offer these courses in intersectionality, and it is not relevant. No one's saying that there aren't some cultural differences, and especially if you work with populations that are immigrant populations. This is anthropology, and you should know some of it. You should know what the dietary habits are. You should know, in general, how certain cultures think about illness, and what some home remedies might be, because some of them might be even actually harmful sometimes, but that's important stuff. So that goes into the term cultural competence, which is fine. That's a kind of almost organic knowledge you should have and would come to have more if you work with immigrant populations. So that's all fine. But again, this now it's turned into a very almost a kind of an intolerance and a kind of almost surveillance of having to look at everything through the lens of, again, racism or oppression. And it's something we should all be sensitized to, because that is a reality of life, but not have it dominate our worldview and distort it.
Yeah, it prevents us in general, but I would imagine psychiatrists specifically from seeing people as individuals and really looking at their problems.
Well, that gets into a whole other issue, and we probably don't have time for it, but I'll mention it briefly, and then you can tell people where to read more about it. But not so much in psychiatry, but in the counseling profession, there is a very, very aggressive effort to introduce what a colleague of mine has called like social justice therapy. There's kind of no name for it,
right.
But it is extremely worrisome, and it is, just as you started to say, it's this view of the patient not as an individual, but as a member of the group, whatever identity group he or she is a member of. And it's a kind of approach, a kind of therapeutic, sort of movement where the therapist kind of comes into the session with almost a preformed script or narrative of what's going on. So, for example, if you're a minority patient and you're a client, they would call them, but and you're complaining about your boss, it could well be your boss is prejudiced against you. That could well be, but you don't. My goodness, you don't approach the person with this assumption that all your problems are due to a hostile environment. And if you're white, I mean, there've been lots of vignettes, online about this, about white folk, especially white men, and God forbid they find out you voted, for Trump, that you're pathological, just based on that. Plus, of course, you're an oppressor out of the gate,
right?
And I mean, first off, this is not therapy. It's ideology. I mean, frankly, it's malpractice, is what it is. And I've encouraged people to be honest, to sue. And for people who are in training programs where they're being inculcated with this kind of approach, I think they should sue for fraud. that the program is really just not providing competent therapeutic training. But how do you have any kind of trusting relationship? It's called a therapeutic alliance with a patient, a white kid who's walked in and wearing, let's say, God forbid, a MAGA hat, and already you're lecturing him.
Right.
I mean, this is unheard of. I mean, it's unrecognizable, this therapy. And yet, as people are rolling their eyes going, I don't believe it. Unfortunately, I can give you examples.
All right, let me tell you about one of my favorite sponsors, and that is Dwell. It is a Bible app, and it's inspired by the psalmist's command to hide God's word in your heart. We've already established that a lot of us are busy, whether we're moms or whether we're students or whether we're working, whatever it is, all of us are on the go all the time, which means that it's actually even more important that we are hiding God's word in our heart, that we are meditating on his truth, that we are remembering what God says is good and right and true, and renewing our minds with his word. And that is why Dwell app exists, so that we can listen to the word even as we are doing all the things that we are doing throughout the day. Our busyness should not be an excuse for not reading scripture, especially when something like Dwell app exists. We can listen, either sit there and read along and listen, or as we are doing the things that we have to do throughout our day, we can be also meditating on God's word. They've got all different kinds of versions, all different kinds of voices, all different kinds of artwork as a background. They really make an amazing reading and listening experience. So to get started with Dwell, go to dwellapp.io/relatable, get 10% off for a yearly subscription, or 33% off Dwell for life. That 33% off means you save $50. Make sure to visit dwellapp.io/relatable, commit to scripture for the rest of this year or for life. Well, I absolutely know what's happening, because we're talking about some of those Instagram accounts earlier, and it seems like the whole therapy online world is absolutely the wokest world and the quickest to categorize people based on these preconceived notions that's informed by these academic ideas like intersectionality and critical race theory, which don't necessarily translate to an individual's circumstance. And I just think of two things in my own life. One, I had a counselor who helped me through an eating disorder when I was in college, and then two, I think about another thing. When I was young, I was a little bit of a tomboy in that I wouldn't wear dresses, and I had two older brothers, and I didn't want to wear bows or anything like that. And I just think about if today's psychiatry or therapy world had informed those different situations in my life.
You'd be on testosterone now. Yeah.
Right. And if the preconceived notions of, okay, well, this person is dealing with this, so it must be this, without knowing anything about that person's, individual circumstances or what they're dealing with. I mean, who knows if I would have been helped, if I would have just been considered some kind of oppressor or complicit in racism because I was white in college and I didn't actually get the individualized help that I needed with my eating disorder, or if I had been young and they just assumed because I don't want to wear dresses that I must be a boy. Like, who knows how my life would have turned out. But politics and these kind of the political priors of progressivism that so many medical professionals are using as they go in to treat patients, I mean, that really scares me. That just scares me. That's for terrifying. What kind of care people, and especially young people, are going to get.
Yeah, it's terrifying. You come into therapy and you're there because you have a problem. You're there because you're often kind of shaken in some way. You're fragile and you're very vulnerable. And then you get someone whose whole therapeutic stance is shaped by ideology. It's really therapy for them. Well, that's why I'm telling you, I really think that, people should sue. I know that sounds fairly aggressive, and I've personally never sued anyone in my life. But if I were subject to this, I would. There are some groups that people can appeal to try to get names of. I mean, I'm on some listservs where it says, so-and-so has a patient who wants to work with they'll use the phrase like a non-woke therapist. I mean, people going out of their way. They're
Oh,
almost
I absolutely would.
assuming that this is the way they'll be approached. That's so
I
unhealthy.
know it's crazy, but if I were looking for a counselor, even, as a Christian, there are plenty of woke people who are, in Christian therapy too. I would absolutely check to see. I mean, this is just me. I'm not saying everyone should do this, but I would check to see if that person has pronouns in their profile, like what they're saying about things like gender and how they're approaching the subject of racism and social justice, because I don't want to be hated. That's what I would fear, that I would be hated walking into a therapist's office and that they wouldn't take me seriously because they just assume that I'm on the bad side because of my politics or my worldview or because of the color of my skin. I don't think we should have that kind of fear talking to people who want to help us. I'm scared that my views would be weaponized against me. So someone like me, I just won't seek help then. I just won't seek help because I'm too scared that the institution has been so thoroughly captured that I'm going to be seen as the bad guy when I'm really trying to get help for a problem. And I feel like I'm sure a lot of people feel that way, probably especially white men. That's probably, I would say, a problem. You just fear that you're going to be seen as the bad guy in all of this.
Yeah, or have been seen and then drop, and then drop out of therapy. So, pardon me, you're right. That's a major aversion. Pardon me, to getting help. It's so painful to think about. Someone who's desperate and they're in those hands. Anyway, it's just awful. Well,
just to kind of close out, I'm wondering if you can just like paint a picture, just summarize if both the positive and the negative, maybe the pessimistic and the optimistic outlook on how this could go. So if this continues to manifest itself, the loss of agency, the intersectionality and critical race theory kind of dominating someone's view of therapy and psychiatry, like how would that look long term? But then also, if there's any positivity that you see in this direction, any positive change in people kind of realizing that that's a problem and really trying to work towards giving good individualized care. So if you could just kind of show us the good and the bad, the possibilities, the future of this.
Well, actually, I think you summarized the bad very eloquently a few minutes ago, that, people realize they're not being helped. I mean, basically, pardon me, you may see something on my computer there. To the extent that a patient finds this kind of gratifying, in other words, they want to hear this, that they're a victim, then in some ways you've got a support group of two. That's not therapy. That's not challenging someone, in a constructive and gentle way. But people need to be challenged because, as we talked about earlier, they're often, not always, but often contributing to their problems. And ideally, a person comes into therapy saying, I feel I want to understand what I may be doing to make myself or contribute to my unhappiness. I want to understand myself better, and but then you need a therapist who says, well, that's an important question, and let me hear everything. I will sit back and listen. Probably for 2 to 3 sessions. Really, it's just gaining a lot of information, developing trust. That's how it should work. If that doesn't work, frankly, and you get told day one what your problem is, frankly, run for the hills. The good news is that, so I think patients, although God knows how much damage will be done before this happens, will start to realize that this is not constructive. I'm not learning about myself. My life isn't changing. If anything, it's getting worse. But the good news right now is that there is a group that has formed, kind of almost like a remedy to the American Counseling Association, which is the professional organization for so many counselors. Now there's a group called the International Association for Psychology and Counseling. International Association for Psychology and Counseling, which is a group that's been started by frankly, a former president of the American Counseling Association, who says, No ideology. There should be no ideology in
That's
counseling,
good.
short of what we, short of, of course, theory about what we know about the human mind and behavior and how people change. But that's fine. That's clearly what one is trained to do in these jobs. When one takes these jobs, and we will be a clearinghouse for training, and we could refer people if they need counselors who are classically professional. And so that to me, that was very encouraging.
Yes, that is an encouraging development that people are recognizing this and organizing to push back against it. It's going to be a battle. And so I'm hopeful, though, based on what you just said, and I'm hopeful that people like you exist and that you've been talking about this and writing about this for a long time. I agree. It should be without ideology. The goal is to help people. The goal is to heal people. And we can't do that if we are blinded by our preconceived notions of what we just assume they're dealing with based on our politics.
Right. Or turn them into activists, which is another agenda item.
Man, and there's just so much there. That seems to be the problem, one problem in education too. And just to touch on, I know we got to go, but one thing that you said earlier that I thought was so interesting and is my question too, in like K through 12 education, where we're seeing some of this ideology come about in the curriculum. You asked for psychiatry students, what is being displaced? What's being displaced by this overemphasis on things like critical race theory and victimology? Because everything, you would probably argue that a psychiatrist has to learn just about psychiatry. That's a lot in itself. That's, full time. I wonder the same thing about curriculum in K through 12 as they are having hour-long sessions about, intersectionality. Like, okay, how much time are you taking away from science? How much time are you taking away from math? How much time are you taking away from reading? And do our numbers show that students in America need less of that? I don't think so. Gosh, this is such a pervasive problem, and I'm very thankful for your voice and how you're talking about it in such a professional and persuasive way. So thank you so much.
Oh, thank you very much.
Thank you. Just to close this out, one thing that I wanted to make sure that we mentioned that I didn't get into with her because it wasn't a theological conversation that we are having. But as Christians, one thing that I want to point out is that while I think that professional help when it comes to mental health is really important and necessary for a lot of people, I think medicine, when it is necessary for people's problems, is a gift of common grace that people should feel no shame when they need those treatments, when they need that care. They should feel no shame in taking part in those things. Ultimately, we believe that the answer to our individual problems and to societal problems is the gospel. The reason why professional help, even though it can be so important, will ultimately fall short is because it doesn't deal with the problem that is in our hearts. Like, it doesn't deal with the real reason for a lot of the emptiness that we feel, or the purposelessness, or the loneliness that we feel. The only person who can truly tell us who we are is the God who created us, who tells us who we are and what we're worth and why we're here, who gives us the ultimate hope, not just moment by moment hope, but the ultimate hope. And so if we really want to be known, if we want to be understood, if we want to know what it means to be accepted, if we want to know what it means to be truly loved, then we have to look at the gospel, because in Christ, we are accepted by this perfect, holy God who created us and created the universe. In the gospel, we are given purpose. We are given hope, the hope of eternity in heaven, the hope of goodness and joy forevermore. And so the real, ultimate, eternal antidote for any despair that we have, and this doesn't preclude, tangible help here on earth, but it is the ultimate answer to all of the problems and the feelings of lack that we have here in this life, is the God who created us, is the gospel. So I would be remiss if I didn't mention that in a conversation about all the problems that we're facing as individuals and as society, that only the God who made us can really, truly know us, see us, fix us. And so in all of the steps that we take here in this life to help our mental health, let us not forget that the God who made us and loves us is the ultimate and eternal answer to all of our problems. All right, I hope that was an enlightening and encouraging conversation for all of you. I will be back here tomorrow.